We have all heard and known acid refluxes. I mean, with so much processed food available nowadays and all that junk you are eating. But trust me when I say this, around 85% of people with acid refluxes don't actually know the mechanism behind it. What really causes acid refluxes? You see, to put it simply, the tummy has a deadly chemical known as hydrochloric acid inside us. Well, what can hydrochloric acid do? For starters, it can dissolve iron within minutes to hours. Complete disintegration might take several hours to a day. That is some Mad Max stuff in our stomach. But when I was younger, I would ask myself, if hydrochloric acid is that dangerous, how come it doesn't crawl out of our tummy? Well, there is one weakness where the hydrochloric acid humbles itself to. That is the mucosa lining inside our stomach. The innermost layer of the stomach's mucosa is composed of specialized cells that secrete a thick layer of mucus. This mucus layer forms a protective barrier between the stomach's acidic contents and the delicate cells of the stomach lining. Mucus is rich in glycoproteins, which make it viscous and resistant to the corrosive effects of stomach acid. Now back to acid refluxes. You see, when you eat spicy or processed food or carbonated junk, the glycoproteins are not that powerful against some heavy, chemicalized processed foods. The glycoproteins are basically doing their best to protect our linings. But, for instance, high-temperature foods, or when eating too much of spicy food, it raises the temperature inside your stomach, and that's not good for your mucosa as well. When the mucosa fails, hydrochloric acid attacks the surface of the stomach directly. At first, they are acute as gastritis holes, but later form into chunks like ulcers and to some as worse as cancer. A gas is then produced, and that's when we cry them out loud as acid refluxes. It is as simple as that. Acid reflux, also known as gastroesophageal reflux disease, GERD, is a common digestive disorder that occurs when stomach acid or stomach contents flow back up into the esophagus. The esophagus is the tube that connects the mouth to the stomach. Normally, a ring-like muscle called the lower esophageal sphincter LES acts as a valve, opening to allow food and liquids into the stomach and closing to prevent stomach contents from flowing back up. In individuals with acid reflux, the LES may weaken or relax inappropriately, allowing stomach acid to splash back into the esophagus. This can lead to a range of symptoms, including heartburn, a burning sensation or discomfort in the chest, often behind the breastbone. It's usually felt after eating or when lying down. Regurgitation, sour or bitter-tasting fluid may flow back into the mouth, along with an acidic or bitter taste, chest pain that can sometimes mimic the symptoms of a heart attack. It's important to differentiate between heartburn and heart-related chest pain, difficulty swallowing, sensation of food getting stuck in the chest or throat, also known as dysphagia, persistent cough. Chronic coughing, especially at night, can be a result of irritation in the esophagus. Hoarseness. The acidic stomach contents can irritate the vocal cords, causing hoarseness or changes in the voice. Sore throat. Irritation from stomach acid can lead to a sore throat or a constant need to clear the throat. Asthma. In some cases, acid reflux can trigger or worsen asthma symptoms. Get ready for today's video where we're going to talk about 6 special vitamins and minerals that can help say goodbye to acid reflux forever. These things are like helpers that can make the stomach feel right again by fixing its special juice level. And guess what? We're also going to share easy changes you can make in how you live that can fix the real problem behind all this. Now, when I say helpers, I mean not just vitamins, but also things like minerals, herbs, and natural stuff that can make acid reflux better. Remember, the information provided is for educational purposes only and should not substitute informed medical advice or care. 1. Zinc L-carnosine. Zinc is like a special mineral that the body needs to fix parts of itself, especially the insides, epithelium. A group in Japan made something helpful called zinc L-carnosine, which they've used for a long time to help with tummy sores. It's really good at making things better when your food pipe, tummy, or intestines are hurt or swollen, like with sores. The lining of the stomach and the digestive tract has a protective layer of mucus that shields it from stomach acid and other potentially harmful substances. Acid reflux can damage this protective layer. Zinc carnosine is thought to help restore and enhance this mucus barrier, creating a shield against stomach acid and promoting the healing of damaged tissues. Some studies suggest that zinc might influence the movement of the stomach and its contents, gastric motility. This could potentially impact the timing of stomach emptying and the movement of acid from the stomach into the esophagus, affecting the occurrence of acid reflux. It also helps your tummy by bringing back the protective gooey layer in your whole digestion system. This helps your body fix itself. Also, regular zinc stops too many bad bugs like H. pylori from growing in your tummy. If you want, you can take a little pill with 75 mg of this helpful zinc carnosine every day. Men need about 11 mg of it, and women need about 8 mg of it. You can find it in good foods like shellfish, meat from healthy cows, and pumpkin seeds. 2. Probiotics. Probiotics are like tiny, friendly bugs that live in your belly, specifically in the big part of your intestine. They are good at helping your tummy break down the food you eat. These friendly bugs also create special messengers for your brain called acetylcholine. It's like they talk to your brain. These bugs are important because they can make your nerves active. These nerves control a door-like thing called the LES valve. This valve is right above your tummy. The friendly bugs make the valve open when you're eating and close when you're done eating. It's like they help your tummy know when to let food in and when to keep it closed. So these bugs are like a helper for your tummy and your brain working together. If you have lots of helpful bugs in your belly, you're less likely to get tummy problems like acid reflux, upset tummy, sores, tummy inflammation, tummy sensitivity, and problems with your body's defenses. These bugs are like tummy protectors that keep everything running smoothly. But sometimes these helpful bugs are not enough because things like medicines, fake sugars, and unhealthy foods can hurt them. This can cause tummy issues like acid reflux. So it's good to have these bugs to keep your tummy happy and working well. To make things better, try eating foods that have gone a little sour like kimchi, sauerkraut, kefir, and pickles. Have them often. These foods have lots of helpful bugs that can fix your tummy and make your body stronger. 3. Betaine Edge CL with pepsin. A really good supplement to stop acid reflux is called Betaine Edge CL. It's great because it tackles the main issue causing the problem. You can take 2 to 4 little capsules of Betaine Edge CL, each with 1300 mg before you eat. This helps make your tummy more acidic and can stop acid reflux. Stomach acid, hydrochloric acid, is crucial for proper digestion. It helps break down food, activate digestive enzymes, and create an acidic environment that prevents the overgrowth of harmful bacteria in the stomach and upper digestive tract. Insufficient stomach acid can lead to incomplete digestion, which may trigger acid reflux. Betaine Edge CL is a source of supplemental hydrochloric acid that can help restore the stomach's acid levels. Adequate stomach acid is necessary for the proper breakdown of proteins into smaller components. Incomplete protein digestion due to low stomach acid can lead to the formation of larger protein fragments, which might contribute to discomfort and reflux when they enter the esophagus. This can make your tummy handle food better. The special valve, called LES, will close up properly and stop things from coming back up. Follow this plan for 2 to 3 days. If you want, you can slowly add more capsules each time until you feel better. After a few weeks, your tummy will get stronger and your digestion will go back to normal. 4. Ginger. Acid reflux can hurt a lot and make you feel uncomfortable, especially when you're trying to sleep at night. The pain can keep you awake. Here's a quick solution. When you have heartburn, try chewing on a fresh piece of ginger root. Ginger root has strong compounds that can calm the parts inside your food pipe and stomach. This helps with the inflammation that comes from the acid. The lower esophageal sphincter is a muscle that separates the esophagus from the stomach. It's responsible for preventing stomach acid from flowing back into the esophagus. When this muscle relaxes improperly, it can contribute to acid reflux. Some studies suggest that ginger may help to relax the LES in a way that doesn't promote acid reflux. This is thought to be due to the actions of gingerols on the muscles. Ginger has been known to promote proper digestion by increasing the movement of food and fluids through the digestive tract. This can help prevent the buildup of stomach acid that can lead to reflux. If you want, you can get capsules with dried ginger powder. After you eat, you can take 1 or 2 of these capsules to help stop acid reflux from happening. I also suggest taking off the skin of fresh ginger and cutting it into tiny pieces for your salads or stir-fried. You can even make a spicy drink with ice and cold water using ginger. 5. Apple cider vinegar. Apple cider vinegar is a popular natural way to help with tummy troubles like indigestion and heartburn. Here's what you can do. Take a big glass of water and put in 1 spoon of special vinegar called apple cider vinegar. Use a straw to drink it before you eat your meals. This special vinegar has something called acetic acid. This acid can fix the tummy's pH, which is like its balance. It makes digestion work better and stops problems like acid reflux and GERD. Acetic acid is a type of good stuff for your tummy. It also gives energy to the cells in your colon. These cells help you digest food and take in important things like vitamins and nutrients. Counterintuitively, apple cider vinegar is acidic, and it's thought that consuming a small amount of acidic substance like apple cider vinegar might actually increase stomach acid production. In some cases of acid reflux, the issue might be not having enough stomach acid, which can lead to improper digestion and pressure on the lower esophageal sphincter, contributing to reflux. By increasing stomach acid, apple cider vinegar could potentially improve digestion and reduce the pressure on the LES. Apple cider vinegar contains enzymes that could support digestion by breaking down food more effectively. This could reduce the time food spends in the stomach, potentially decreasing the likelihood of reflux. Lots of folks think that apple cider vinegar is the easiest and best way to help with acid reflux. But if your throat or food pipe is really sore, you might want to try something else. Instead of drinking vinegar, you can take 2 to 3 little capsules of apple cider vinegar before you eat. It might be gentler on your sore parts. 7. Vitamin D. Vitamin D is a fat-soluble vitamin that plays a crucial role in maintaining bone health, supporting immune function, and regulating calcium metabolism. However, its influence extends beyond these functions, as emerging research suggests its involvement in gastrointestinal health, particularly in the context of acid reflux. The esophagus is lined with specialized cells that maintain a tight barrier between its acidic contents and the sensitive tissue beneath. Studies indicate that vitamin D may enhance the integrity of this esophageal barrier by regulating tight junction proteins that control the permeability of the esophageal lining. Vitamin D's anti-inflammatory properties may also contribute to reducing esophageal inflammation, a key factor in acid reflux pathogenesis. Furthermore, vitamin D has been shown to modulate muscle function within the gastrointestinal tract. The lower esophageal sphincter is a muscular ring that separates the stomach from the esophagus. A weakened LES can contribute to acid reflux by allowing stomach acid to flow back into the esophagus. Vitamin D receptors are present in the smooth muscle cells of the LES, suggesting that vitamin D might influence its tone and function, potentially aiding in the prevention of reflux episodes. While the human body can synthesize vitamin D when exposed to sunlight, dietary sources are also essential, especially for those who have limited sun exposure. Foods rich in vitamin D include fatty fish, such as salmon, mackerel, and tuna, fortified dairy products, egg yolks, and certain types of mushrooms. Recommended daily intake, 600 and 800 IU for most adults. Potential benefit at 1,000-2,000 IU for acid reflux patients. Now let's find out why and what causes acid reflux. Hiatal hernia. One of the primary causes of acid reflux is a hiatal hernia, a condition where a part of the stomach protrudes into the chest through the diaphragm. This disrupts the natural barrier between the stomach and the esophagus, leading to acid reflux. Weak lower esophageal sphincter. The LES is a ring, like muscle at the bottom of the esophagus that prevents stomach acid from flowing back. If the LES is weak or relaxes inappropriately, it can allow stomach acid to reflux into the esophagus. Dietary factors. Certain foods can trigger acid reflux episodes. Fatty, spicy, acidic, and caffeinated foods, as well as chocolate, citrus fruits, and tomatoes, can relax the LES or directly irritate the esophagus, leading to reflux. Obesity, excess weight, especially around the abdomen, increases pressure on the stomach and LES, promoting acid reflux. Additionally, adipose tissue produces hormones that may exacerbate reflux symptoms. Pregnancy, hormonal changes and increased pressure on the abdomen during pregnancy can lead to relaxation of the LES and subsequent acid reflux. Smoking. Smoking weakens the LES and increases stomach acid production, increasing the risk of acid reflux. Alcohol. Alcohol can relax the LES and irritate the esophagus, making it more susceptible to reflux. Medications. Some medications, such as non-steroidal anti-inflammatory drugs, aspirin, certain muscle relaxers, and blood pressure medications can contribute to acid reflux. Delayed stomach emptying. Conditions like gastroparesis, where the stomach takes longer to empty its contents, can increase the risk of acid reflux. Stress. Chronic stress can impact digestion and lead to changes in the body that trigger or exacerbate acid reflux. Connective tissue disorders. Disorders that affect connective tissues, such as scleroderma, can weaken the LES and contribute to acid reflux. Certain medical conditions like asthma, diabetes, and sleep apnea can increase the likelihood of acid reflux. Position, lying down, or bending over after a meal can increase the risk of acid reflux, as gravity is less effective at keeping stomach acid down. Tight clothing. Wearing tight clothing, especially around the abdomen, can increase pressure on the stomach and promote reflux. How to stop acid reflux. 1. Opt for natural solutions. Instead of relying on antacid drugs that neutralize stomach acid, consider using betaine edge CL or apple cider vinegar before meals. These substances naturally enhance digestion, help close the reflux valve, and restore the stomach's balance, aiding better nutrient absorption. 2. Embrace cabbage power. Incorporate raw, shredded cabbage into your daily diet. You can choose from various types like red, green, or Savoy cabbage, or enjoy sauerkraut as a delightful salad. Cabbage is packed with beneficial components like glutamine, chlorophyll, and vitamin C, which facilitate the healing of your stomach lining, esophagus, and intestines, repairing any damage caused by acid reflux. 3. Choose wholesome nutrition. Reduce the intake of refined grains and vegetable oils such as bread, pastries, cereals, corn oil, and soy oil. Instead, swap these processed foods for nourishing whole options like pasture-raised eggs, wild fish, grass-fed meats, extra virgin olive oil, and steamed vegetables. These choices provide essential nutrients, supporting your overall health while potentially alleviating acid reflux. 4. Enhance stomach health. Give a boost to stomach acid production by sprinkling Himalayan salt or Celtic sea salt on your meals. These salts contain essential chlorides, like sodium chloride, that aid in creating hydrochloric acid in your stomach. Additionally, include foods high in potassium in your diet. Potassium activates cells that promote stomach acid production. Avocados, leafy greens, wild salmon, beet tops, squash, and Brussels sprouts are excellent sources. Chewing your food more thoroughly aids in breaking it down, easing digestion. 5. Refresh your morning routine. Kickstart your day by drinking a tall glass of carbonated mineral water. This helps hydrate your digestive tract, and the mild acidity of the mineral water can strengthen your stomach's feet. While doing so, consider reducing your intake of tea and coffee temporarily until you have your acid reflux in check. 6. Tackle stress for digestive health. If stress or sleep troubles are constant companions, addressing them is crucial. High stress levels activate your sympathetic nervous system, which can exacerbate acid reflux. Combat this by engaging in relaxing activities. Long, leisurely walks outdoors, at least 45 minutes daily. Infuse your body with oxygen and calm your nerves. Incorporating probiotic-rich foods into your daily meals not only aids digestion, but also helps manage stress, contributing to overall digestive system healing.